We knew this was coming, but it is still really hard to hear. The U.S. hit 250,000 COVID deaths today. I said it earlier, and I will say it again. That is 250,000 Americans gone because of the coronavirus. The latest White House coronavirus task force report is saying there is now aggressive, unrelenting, expanding, broad community spread across America. Pennsylvania setting a new record for daily cases, over 6,000, while hospital admissions there are near all-time highs. In Texas, almost 8,000 people are in the hospital with COVID. Nearly 1 out of every 6 of them is in El Paso.
We're seeing numbers go through the roof, and we're at capacity at every facility in El Paso, where hospitals are setting up tents and parking lots to house patients that need that care.
NBC News correspondent Morgan Chesky is outside a hospital in El Paso. NBC News Now correspondent Maura Barrett at a nurses' strike in Langhorne, Pennsylvania. Maura, this is the second day nurses are striking outside St. Mary Medical Center. What are they asking for, and what is the hospital saying?
Allison, the nurses are looking to draw attention to what they say are dangerously low staffing levels here at this hospital, and they're calling it a microcosm for what we see across the country. These nurses are risking their lives going to work every day, treating COVID patients, and they're asking the hospital to hire more staff and also work to retain them better. This hospital in particular has lost 250 nurses in the last year, 40 alone in the last month or so. And it's very concerning as we're going into the second wave. They're tired, they're fatigued and exhausted from this never-ending pandemic, it seems. And I want you to listen to what they describe as a typical day in the life as a nurse during this pandemic.
A typical day in the life of the hospital is a nurse that is overburdened with patients. We don't have enough nursing assistants. We don't have enough housekeepers. And the nurse has become the unit secretary, the housekeeper, the aide. And it's just not fair to the patients. It takes away from patient care.
We have lots of concerns about being able to staff the hospital properly. COVID compounded that problem because it takes probably double the labor to take care of a COVID patient with all the PPE and all the other things you have.
And at the end of the day, we leave exhausted and unfulfilled because, this is a principal matter for us. These suits, they see these people like widgets. They run it like a corporation. These people are not widgets. They are our community members. They are people that we walk among.
You leave exhausted wondering, did I do the right thing? Did I do enough? Did I help? And that's not a good feeling when you're leaving the hospital and you feel like you didn't do enough.
I don't know if we have any.
As for the hospital and the overall company that owns the hospital, they've been in negotiations since before the pandemic started. It actually stopped during the first wave, and the nurses said that they wanted to settle everything out before the second wave. And so I reached out to Trinity Health Systems. I want to read you part of the statement they sent back. They expressed concern that nurses are striking at this moment when we're seeing the second wave. But they said PSNAP, the union that represents the nurses, and St. Mary's bargaining committees had some productive dialogue around staffing, but we believe the main sticking point was wages. The bargaining unit members went ahead with their planned strike on November 17th, and we recognize their legal right to do so. Now, on that note, on wages, several nurses telling me their former colleagues actually went to other hospitals in the area simply because they would make $6+ an hour at those other hospitals. So they're asking the hospital to level up their pay, especially as they're getting ready to tackle this second wave.
Maura, let's talk about what else is going on in that state. Pennsylvania reporting over 6,000 new COVID cases today. How is PA trying to get this under control?
Yeah, an absolutely staggering number, Allison. It's almost triple or quadruple the peak of what we saw back in the spring. So clearly very concerning. The governor and the Secretary of Health here saying that they're actually going to they enacted stricter mask requirements. So there's already a statewide mask mandate, but now it is required whether you're inside or outside with anybody that's not in your immediate household. So a lot of concern when it comes to that, because that is obviously the main way we see the spread. The other new action they're putting into place is that anybody that travels outside of Pennsylvania and wants to come back needs to have a negative test within 72 hours or quarantine for 14 days.
All right, Maura Barrett in Pennsylvania, thank you so much. Now let's go over to Morgan Chesky, who's in El Paso, Texas.
Yeah, Allison, good afternoon. And we are back in El Paso for, unfortunately, all the wrong reasons. We've been following the numbers here, and I just want to share a few of them with you to put this in perspective. Right now, of all of the patients in El Paso area hospitals, and that includes these temporary tents, 52% of them are all being treated for COVID-19 symptoms. And we know that ICUs are, if they're not at capacity, they are absolutely close to it, to the point that many patients are having to be flown to Austin, Dallas, Houston, San Antonio, where hospitals there are slowly but surely running out of room themselves as these numbers in Texas continue to slowly tick up, but nowhere near as fast as they are here in El Paso. We know that right now more than 30,000 active cases are in this county. That number more than those in Dallas and Houston areas combined. We've had a chance to witness the impact of this firsthand when we were here last week and we saw the arrival of those mobile morgues. We know that more than 200 bodies are currently stored in those refrigerated trailers outside of the medical examiner's office simply because there's nowhere else to take them. On top of that, staff at the office is so small that they've had to enlist the help of local inmates, trustees, to assist in moving some of the bodies. The concern right now from officials is how do they slow the spread of this virus when it's already this rampant? And we know that the county judge, an elected official here, who had a shutdown recently overturned, is now trying to come up with a set of restrictions that will have the blessing of both the state and local parties that hopefully people can abide by to try to drive down some of these numbers, because as it stands right now, if it continues unabated, hospital officials are concerned that they could reach that imaginary wall that they don't know what exactly is, but that would cause an absolutely worst case scenario here. Allison?
If you still don't think the coronavirus is serious, listen to this. Some U.S. hospitals are dealing with patients so sick they have set up units just for people to go and die.
I've seen people more sick than I've ever seen in my life, and they just drop so fast. We're understaffed. We have so much on our plates as nurses. There's not enough of us to help. We have, I think they said 10 COVID units, and one of those is just a place for people to go and pass away, unfortunately. Please take it seriously, wear your mask, and I hope I don't see you here.
Joining me now, Dr. Dara Cass. She's a Yahoo News medical contributor and an associate professor of emergency medicine at Columbia University. Dr. Cass, thank you for being here. It is so horrifying to hear about death units at Nebraska hospitals and mobile morgues being brought in to El Paso, Texas. But the reality is that is what is happening in our country right now. I know you were in the ER in New York at the peak last spring. Could you just describe for people what it is like to treat people who are this sick and what it is like in some of these hospitals right now?
So really, it's overwhelming. In New York City, when it was the height of the pandemic for us, we were having patients really, the only way to describe it is that they would suffocate in the hallway sometimes before, if we didn't have any treatments for them, or more importantly, if, for example, they had just gotten there too late, or if there were no more beds, we would be addressing their needs as quick as we could, but there is always going to be a limited capacity. The issue we're seeing now is that as these hospitals get overwhelmed and patients are there for such a long period of time, you're going to find rooms of patients that there's just nothing left to do. And so you want to make sure they're comfortable and that they're as safe as they can be while the virus unfortunately takes hold of their body. It's very traumatic for obviously healthcare workers and for patients who are alone in the last moments of their life at overwhelmed hospital systems, really just having no other choice but to sit there and wait.
There are people in America who still compare COVID to the flu. People who think, I haven't gotten sick, I don't know anyone who's sick, so this can't be that bad. Given how bad things are right now and the concerns that we have that this could only get worse this winter, what is your message for Americans who aren't taking this seriously or who aren't sick? What are the most important things the average person should be doing right now?
The most important thing the average person should be doing is wearing a mask and staying distance from people that they don't know, remembering that human contact, that interpersonal contact, is by far the fastest way to get this virus. We are seeing exponential spread all over the country. We've seen over 12,000 cases alone yesterday in the state of Illinois. You know, this is unbelievable. These are numbers we have never seen before, and it's not going to get better without people on the ground making the choice to mask up, stay distanced, and stay home if they can, because we have to get through the worst of this before any vaccine or any therapeutic is going to get us to the end.
Dr. Cass, New York City Mayor Bill de Blasio is closing the city's public schools starting tomorrow and going back to remote learning because the city's 7-day average for testing positivity is back up to 3%. I'd love to get your reaction to that decision and what else you think New York City needs to do given those numbers.
So I have two roles here as a physician and as a New York City public school parent. It's very frustrating to see that our schools are closing because of the virus spreading in our city when we've done such a good job at keeping it at bay. This was the number that was set out by the mayor when we opened schools, and he said if we hit 3%, we were going to close. And on one hand, I respect that we're sticking with that number because it is the number that they set out, and we know that we have to have the standards in order to meet them and then actually bring back the virus down to a level that we can. On the other hand, we're seeing that really schools are not where the virus is spreading. And so we know that we've seen a 0.2 to 0.3% transmission rate in New York City schools because we're testing students. And we really could keep kids in school if we could get the virus under control in the rest of the city. What we know is that the virus is out of control in the country, and New York City just couldn't keep its barriers up for very much longer. And it seems like it's seeping into our city, and we're going to have to start shutting things down as well.
Let's talk about Thanksgiving. The prevailing advice here is to skip travel, stick with your immediate family at home. But some people are getting COVID tests. They're planning to be in bigger groups or to travel anyway. Can you explain why a negative test result is not a green light to gather in a group or to travel, and what your advice is for people this holiday?
So this is actually how I frame the COVID testing for Thanksgiving. If you go get tested to try to go to do Thanksgiving, it's the positive test that changes your plans, not the negative test. Meaning that you're testing to find out if you're positive to stop going to Thanksgiving. But if you're negative, you should act like you would before, which is to stay really within your nuclear family, maybe as small as possible, and to introduce as many safety barriers as you can. If you insist on gathering for Thanksgiving, please try to eat with your nuclear family at a different table with another family, even if it's still going to be inside, or try to be outside as much as possible, and even consider wearing a mask while you're together inside, while you're not eating. There are many ways to keep it safer, even if you're deciding to gather during Thanksgiving, against the best guidance of the doctors out there.
Pfizer saying today its COVID vaccine is now 95% effective, up from 90% last week, and it's going to apply with the FDA for emergency use authorization within days. What are your lingering concerns about this vaccine, if any? And when do you think healthcare workers could start getting their first doses?
So remember, we have not seen the data yet. We've just seen the press releases from Pfizer and also from Moderna. And we're waiting to see that data to figure out exactly which patients were prevented from having an infection. And more importantly, did this prevent infection or just symptomatic illness, and really what that looked like on the granular level. This is very exciting information. The Pfizer and Moderna have both been very consistent with their information and their time courses, and they had an enormous number of patients get vaccinated and even exposed to the virus. So I'm very excited about this information coming out. We expect the first doses of this vaccine, if everything comes together as we're seeing it, to be available late 2020, beginning 2021. That's when healthcare workers should start seeing the opportunity to get vaccinated. And then the general population should be able to be vaccinated, hopefully mid-2021 into the fall.
Dr. Cass, such a pleasure to have you with us today. Thank you for all of the good advice. We really appreciate it.
Thank you. Have a good day, Allison.
You too. Pfizer just days away from submitting its COVID vaccine to the FDA for emergency use authorization, a vaccine it now says is 95% effective with no serious safety concerns. NBC News correspondent Stephanie Gosk has the latest details on what could be the first COVID vaccine in the U.S.
This morning, Pfizer says it's just days away from submitting its vaccine for emergency use authorization from the FDA, and that the results from its ongoing phase 3 trial are even better than what the company reported last week. The vaccine 95% effective in trials, according to their latest data. Pfizer reports no serious safety concerns from the study, though it will continue to monitor participants for 2 years. Pfizer says it tested more than 43,000 people and found the vaccine's effectiveness is consistent across different ages and races. The vaccine is also said to be 94% effective in adults over 65, a demographic especially vulnerable to COVID. The 2-dose vaccine is being called one of the biggest medical breakthroughs in a century.
And when I heard the over 90% efficacy, I felt that I was living a dream.
Earlier this week, another company, Moderna, also announced promising preliminary results from its vaccine trials.
As a scientist, as a clinician, I'm thrilled to see vaccines having this kind of efficacy because I really do think this shows that we've got a chance to stop this pandemic.
But while the world awaits a vaccine, demand for testing is on the rise. Overnight, the FDA announcing emergency authorization for an at-home COVID-19 test kit. The kit made by Lucira is the first authorized test that allows users to self-administer a test and get results at home within 30 minutes. This good news comes as the pandemic continues to surge nationwide, with people waiting in long lines to get tested all across the country, making the push for an effective and accessible vaccine even more urgent.
With just 8 days until Thanksgiving, San Francisco's coronavirus testing program is seeing an alarming uptick in wannabe holiday travelers getting tested to see if they're safe to travel this holiday. But that's not what sites like these are for. Here's the city's top public health official.
Please do not travel. Please do not travel. Stay at home with your immediate household. As hard as that might be, we must all exercise caution and do our part. And please, do not use testing to determine whether you can travel or not.
NBC News correspondent Jake Ward is at one of the city's testing sites where close to 1,700 people have been showing up each day. Jake, why is testing the week before you want to travel for Thanksgiving a bad idea?
You know, Allison, so many people have been trying to explain this over the course of the day, and here's my attempt at it. Think of it this way. The virus takes 14 days, as long as 14 days, to show up in your body at testable levels, right? That means that you would have had to get tested and then quarantine 2 weeks before Thanksgiving. That's last Thursday. Right now, me standing here with a crew, my coworkers out in public, not quarantining, if I were to get tested today at this facility, it would still not keep me safe or the people around me if I went to a Thanksgiving and gathered indoors with my family. Fundamentally, this testing is supposed to be for essential workers who are getting it on an ongoing basis. But just, one test a few days, or in this case, a little more than a week before Thanksgiving, is not long enough to do it. You could test negative today and positive tomorrow, and you'd never know. And that's why so many officials are saying don't use tests as an excuse to go out on Thanksgiving.
Jake, let's talk about what kind of stress that's putting on the testing sites like the one where you are right now.
So, Allison, this is an amazing facility. I'll show you. We're in the shadow here of the San Francisco Bay Bridge at a facility that often naval ships use to discharge all of their crew and their equipment. I mean, this is a very big space. This place has been converted into a facility that's testing, 1,700 people a day on average. And that's in a city that leads the nation in per capita testing. San Francisco is testing on average about 6,000 people a day. So, it's great news. I mean, this is a fabulous place. And I look across it and think, wow, isn't it amazing that this one city made it happen? This is not because of federal work. This is because the city of San Francisco decided this was important. This facility, however, is for essential workers and people who do not have insurance. Huge numbers of the people who got COVID in the early phase were the people doing the hard work, being contractors, plumbers, electricians, in addition to the medical workers and first responders. Those are the people that this facility is built for. I think we all have to cop here, Allison, to the fact that there is a real mental strain on us right now. The vaccines are coming, but boy, we could use time with family right now. Boy, we could use a laugh right now. And that's why you're seeing even the California governor, Gavin Newsom, on November 6th, it turns out he went to a largely indoor, arguably fully indoor restaurant meal at the French Laundry with 12 other people. Afterwards, he said, you know, I should have left. I went with my family. I should have left, and I didn't. You and I and all of us are going to be facing that kind of situation. If even the governor, with everything he knows, can't walk out of a dinner, it means you and I have to try extra hard this holiday, Allison.
Jake Ward, with a tough situation there in the Bay Area. Always great to see you. Thank you so much for your reporting.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.